Hi everyone, I'm Lucas Oliveira and today I'll be analyzing a very interesting case study about borderline personality disorder. But first, let's start with some background information about bioethics. The first time the term bioethics was used was in 1970 by a biochemist called Van Rensselaer Potter, simply describing an ethics derived from biomedicine. Also, it's extremely important that we know the four principles or pillars of bioethics. The first principle is the autonomy pillar, which means that the patient controls the right to make decisions freely and independently that agree with their personal values and beliefs. Next, we have the beneficence pillar, which states that we should always seek to do good, and as the golden rule says, we should treat others the same way we want to be treated. Third, the concept of non-maleficence, which is built upon the idea of doing no harm. This principle may enter in conflict with some other principles in situations where the treatment will be beneficial to the patient, but it may also cause some harm. And lastly, we have the justice pillar, which states that doctors should treat everyone equally despite race, sexuality, wealth, etc. This concept can be divided into four parts. Distributive justice, which is a synonym for equity and equality in the healthcare system, respect for the law, your rights, and retributive justice, which deals with what punishment would be appropriate to a crime. The case study we'll be analyzing shortly shows that principle very clear. These four pillars are the foundations of bioethics. According to John Leo, bioethics has hardened into an activist ideology that pervades the medical world, the schools, and the government. In other words, bioethics is everywhere. The highlighted portion shows retributive justice being applied. You may stop the video to read the entire hypothetical. Before we start analyzing the ethical questions associated with the case study, we must identify the stakeholders and carefully state the facts provided by the hypothetical one about each of them. Stakeholders are an individual or institution interested in the outcome of a situation. In the case study being analyzed, we have the following main stakeholders: Dr. Drenning, Dale Strickland, the inmate, the prison guards, and wardens. Dr. Philip Draney works as a psychiatrist at a maximum security prison. He is the one responsible for Dale since he has access to all of Strickland's file. He is also the only professional qualified in the prison to engage in psychological counseling, and he is not available to meet with Dale 3 times a week as requested by the prisoner. Also, Dr. Drain is aware that psychotropic drugs can temporarily reduce Dale's violent behavior, but medications alone are not enough to treat Dale's borderline personality disorder. Dale Strickland was condemned to 15 years of prison but is up for parole after 8 years. He was diagnosed with borderline personality disorder, and Dale wants counseling sessions 3 times a week instead of taking psychotropic medications. Also, he is a patient with extremely violent and harmful behaviors that are caused partially by his mental illness. Prison guards and wardens wanted to put Dale on psychotropic medications because he was causing too many problems for them and with the other inmates. After the U.S. Supreme Court case Washington v. Harper, guards were authorized by law to administer psychotropic drugs if an inmate represents a threat to himself or to other prisoners. Due to Dale's personality disorder, the other inmates were feeling intimidated, they were assaulted, and sometimes they were even sexually abused by Dale. Now that we are familiarized with the stakeholders and with the case study, we can address some ethical questions. Answering the first question about who should decide what treatment Dale will receive, if any, I believe the psychiatrist responsible for the mental health of the inmates should be the one making the decision. In this case, Dr. Draney is the only psychiatrist available, and as such, he should have the final say. But that leads us to the next question. How can Dr. Draney decide what is the best approach to help Dale? Well, as a psychiatrist, Dr. Draney will have to think about the four pillars of bioethics and then decide which principle or principles fit best in the situation. But what should Dr. Draney do to better assist Dale and reduce his violent behaviors? Well, I have come up with four possible solutions. First, Dr. Draney could simply accept the guard's suggestion and neglect the patient's autonomy by putting Dale under the constant influence of psychotropic drugs. Second, Dr. Draney could use the help of the guards to isolate Dale in an individual cell or solitary, but that could also nourish Dale's violent behavior when he's put back into the normal prison environment with other inmates. Third, Dr. Draney could reorganize his schedule in order to attend Dale's demands for 3 therapy sessions per week and administering psychotropic drugs but in small amounts. And fourth, Dr. Draney could ask the prison manager and further the state government to hire additional mental health professionals so they could get more attention and possibly even more than 3 therapy sessions per week. As you can see, the first two options are color-coded in red because they are not ideal for the case, while the third solution has a green coloration because of all four possibilities, that one was the most promising one. Now let's consider all four scenarios, which leads us to the last ethical questions, which are: how will they react to the doctor's choice? And what is the possible consequence that can be generated after the doctor's decision? Well, Dale's reaction will vary depending on how the doctor will treat him. Most likely, if the psychiatrist decides that Dale will have to take medications and be satisfied with 1 or 2 sessions of therapy per week, probably then will react negatively, and he might even become more violent since his demands were not attended. Now, let's look at a few possible consequences if Dale is not properly treated. Consequence 1, Dale will continue with his violent behavior, and once he's released to society, he may represent a danger to all civilians that are unaware of his mental disorder. Consequence 2, if Dale is solely treated with medications, he might develop depression and suicidal thoughts with time. Consequence 3, the other inmates will continue to be intimidated, sexually abused, and victims of other violent acts. And the last consequence is that they will become incapable of returning to society and live in harmony with others. Before answering the question above, we must always keep in mind that the patient's consent should be taken into consideration, unless the patient suffers from a mental health illness or any other condition that might incapacitate him or her from consciously giving consent. That being said, let's look back at our question. Well, all bioethical keys should be used when analyzing and treating a patient. However, we rarely see all key principles being achieved at the same time, which implies that the ones making the final decision will have to look at the big picture and decide which key principles will be the most helpful to deal with the situation. In my opinion, Dale should be heard and have his demands taken into consideration, preserving the bioethical key of autonomy. After analyzing the hypothetical one, the best solution would be to use psychotropic medications alongside with as many therapy sessions as needed. But if 3 times per week is not a possible solution for Dr. Draining, then doing 2 counseling sessions per week, using medication, and giving them the opportunity to work with things like gardening, writing, painting, that will help him to control his borderline personality disorder and violent behavior during the days he's not having therapy. While working, they will also learn some productive skills that will aid him to get a job once he's able to return to society after his period in prison is done, no longer representing a threat to anyone. Thank you for watching, and I hope you have a better understanding of this case study.